I talk a lot about when to use hypnosis. I am such a big fan of hypnosis, I'm constantly promoting it. But in this video, I want to talk about some examples of times when you might not want to use hypnosis, when it might not be a good fit. So first of all, there's a few psychiatric and health situations that can apply. First is epilepsy. We do not recommend people with epilepsy do hypnosis. And then there's several psychiatric disorders where hypnosis is not recommended. Eating disorders, any sort of personality disorder, psychosis, and uncontrollable panic attacks. Those are all examples where hypnosis is not recommended. And many of those are because a person in that situation is already somewhat disconnected from reality, and we don't want to further a spiraling out of that disconnect, because hypnosis is essentially a deliberate disconnect between the cognitive mind and the way we currently experience the world. And for many people, that's really healing. If you're stuck in some sort of loop, it helps you get new perspectives. But if you're already disconnected to some degree from the reality as it is, then having somebody encourage that further could not be the thing that you need. So that's the first thing to keep in mind. The next factor to consider is hypnosis versus other more conventional, maybe therapy treatments, of which there's many, anything from CBT, narrative. There's lots of conventional under the umbrella of talk therapy where you're sitting in front of a therapist and you're kind of having a more conventional dialogue with them. And they're really one of the main factors is whether you want to be doing an interpersonal journey or an intrapersonal journey where you're moving into yourself and exploring yourself. There's a lot to be gained from exploring inwards, of understanding that you have actually many answers to many of the questions that you have in your life, as long as you get out of your own way. And it can be a really powerful tool for that, learning how to navigate your own world, your own body with the help of hypnosis. But sometimes it really helps to have that external support. Another person who can share their own perspective, another person who you can lean on, who can teach you things that you've never even encountered in your own life, and just extending outside the borders of what you've possibly ever conceived of. That's what a therapist can potentially offer you. And so there really are very different things that you can use for your own growth. I, for example, tend to be quite independent and quite really value kind of my own perspective. And I'm drawn to the intrapersonal nature of hypnosis. But I've also gone to therapists for many, many years. And so there really are just different ways of making progress and having and achieving growth in your life. And there is no one right way. In fact, I often recommend to people that they continue seeing a therapist even if they're doing hypnosis. It can be a great way to dive deep during hypnosis and then unpack what came up and really discuss it and make further sense of it with especially since oftentimes we are not qualified mental health professionals. So if there's something a little bit more significant or serious in your life, it helps to have that qualified professional while still diving really deep with the help of hypnosis. And finally, there's different kinds of hypnosis. So our hypnosis-assisted healing modality is quite unique. Most hypnotists take a more here and now behavioral cognitive kind of approach where they're really trying to change you moving forward without getting caught up so much in the past. Whereas hypnosis-assisted healing does place more of an emphasis on why are you the way you are and how did you end up here, and maybe even going back to some specific adverse memories and healing the experience around that. And that's a very subjective choice of whether you feel that that helps you or hinders you, whether you want to go from the here and now forward, also delves a bit into the past so that you make sense of it and then enhances your journey forward. Do you want the hypnotist to take charge and kind of control more of the experience? Obviously, you still have full control on all types of hypnosis, but still, is the hypnotist leading the way, or is it more of a self-directed journey where the hypnotist is more of a supporting guide, which is the role we take on in hypnosis-assisted healing? So as you can see, there's a variety of factors to keep in mind. With mental health, there is no one size fits all. It really depends on your circumstance, on the specific challenges you're dealing with, and then on your own personal preferences. So I encourage you to keep exploring, keep reading articles, looking at videos, and finding that right experience that best for you right now.